Friend, this is a wake-up call to everyone in this country. With respect to the health of our kidneys, in the recent time, it has been one pain or the other, or more or less what you could describe as a saga of one of us having a pain of a daughter, having a challenge of kidney failure, and lo and behold, it becomes today sorrow upon sorrow also for the parents. A call for us to be in position to ask certain questions today. What is the cause of sudden rise in kidney failures among the young ones, the middle age, and even the elderly ones? What is truly responsible for this? We need to know, because the issue that has to do with kidney failure is not poverty friendly. So prevention is better than cure. The reason you should know today, at least you know 10 symptoms of kidney failure. One, I will use to shock you. 10 symptoms of kidney failure. As well as, how do I know if truly this particular disease is in me? Did you know 90% of a man or a woman's kidney can be gone without any symptom? The reason why it is a silent killer. To help us understand this subject, because I realize that most of the language we doctors tend to use, even when some people assume they know nothing. I was talking with a man who had a kidney impairment. And I was just telling him, look at this very thing, your kidney or your renal function not as it ought to be. The man was nodding here, but I knew that he wasn't understanding me. And I asked him, please, can you be in position to tell me where your kidney is? He said, is that one that is here? That is pointing at the chest region. Majority of us truly do not know where this kidney is and what to do. That's why it's important. I first of all tell you this so that you know what to do in order to avoid damage to this that is so precious to everyone. The kidney is not located in the chest. It's not located in the abdomen. It's located at the back, as you can see here. As you can see here, it's located at the back. All right? That is the actual location of the kidney. And what does this thing do? It filters toxin, it filters waste product. What's supposed to otherwise be toxic to the body, it filters good ones and throw away the bad ones. That is the function of the kidney. Nevertheless, this kidney you see here may be undergoing some level of injuries, damage, without the bearer know. In a situation it gets to the level of stage 3 of the kidney disease, it may now start developing symptoms. And this person may manifest any of these 10 symptoms I tell you. Number one is that he may have a problem of fatigue, easy tiredness. He may find it difficult to sleep. He may be having frequency in urination because the kidney is not able to absorb what's supposed to be absorbed. He may have a problem that has to do with itchy skin. He may have also the issue of nausea and vomiting. This same fellow may also go further to have neck swelling or eye puffiness, as if somebody that the face is looking like somebody who is not waking up, who is just waking up from sleep. The person could also have foamy urine. It will go to wee and it will be as if it is beer, that when you pour in a beer drink. Yes, it could be a telltale sign to the issue of kidney disease. Tremor. Yes, it may be in position to have vomiting, and it could be in position also to have bad breath or something like as if it's a metallic taste in the mouth or loss of appetite. Yes, these things will happen. Be that as it may, don't wait for them, because all what I have stated right now can also mimic other symptoms. It could also come from other diseases. So it's not a function of saying, no, it's only when I see this that you will be able to know. It is important to be in position to go for health check, to be able to check if there's protein in your urine. Sign of kidney failure is that there's protein there. If there's blood or protein in that urine, albumin, because they are big molecules which supposed not to pass through the filter of the kidney. Now, how do I prevent the issue that has to do with kidney failure or kidney disease? One is You must identify and avoid the risk factors, as it were. The commonest cause of kidney disease or kidney failure happen to be diabetes and hypertension, lupus erythematosus here. But you also realize that in the recent time, you see a lot of kidney failure even among younger people. You notice that many young people, and unfortunately we've lost some of them in the recent time. And what is responsible? It has also been observed that most of those drugs, concussion, they give you, say it is cleansing your blood, or is doing this on your body, or is doing this. At the end of the day, that thing you are taking, if the liver will not be able to detoxify it, it will push it to the kidney and it can crush it there. That's why it is important. If you are into drug addiction, self-medication, I encourage you, please stop now. Young people have gone into the issue of tramadol and all manner of drugs and abusing it. Tramadol will pack up your kidney. Igbo will pack up your kidney. It is important you start now. Prevention of those things can prevent all those frustration that surround this because of the issue of money. However, I'm not saying that someone who has kidney failure, that is because he's abusing drugs, addicted to something or the other. No, there are people also that may have a problem that is genetic, what is called polycystic kidney, or may have Alport syndrome. Also for men that are having prostate enlargement, but we are not urinating well, if that retained urine over time got infected, it can damage that kidney or kidney stone. All these things that has to do with the kidney, give them attention, and most importantly, take out time, go to the hospital, do a proper evaluation of that kidney, including the glomerular filtration rate, to tell you the rate at which your kidney is filtering this very blood. And here is the good news. In a situation where it has come to a point where the kidney is done, has failed, friend, it is not a death sentence. Forget about that ideology and narrative we used to share. Check out this man. This man, you see, had no kidney functioning for over 40 years. He has been on dialysis and is still living, going to work. We have been able to design a system whereby on 3 months dialysis, you can live as though there was never a case of kidney failure as a threat to life. It is absolutely possible for one to live in this kind of kidney replacement therapy, the dialysis. You can make use of this very email or even the WhatsApp to get more details on things that should be done if there is a need for dialysis, what you should do first. But what I'm here to tell you is that it's no longer as we are being told. Let me also put this across to you. I know you have money. I know you have rejected the country where you belong. I know you have seen nothing good coming out of this very country. But I tell you, if you are thinking of going abroad to go and do kidney transplant, even with your own first-degree relatives, I advise you to rethink. And not only just rethinking, try to do the right thing first, even here. You can have your HLA typing for any form of transplant, be it bone marrow and other. Get it done here so that we will not go and suffer some of the crisis as our brother right now over there on the basis of an attempt to save the daughter has appeared to multiply sorrow upon sorrow. And you know what? There's no rocket science. Take it from me, there's no rocket science in kidney transplant. Kidney transplant can be done excellently here in Nigeria. So many people have done it and still living very, very good. How to live even after the transplant? Make use of this particular email. You get details. You can still fulfill your dream, fulfill your destiny, fulfill the purpose of God here for you, only knowing the right thing to do in terms of how to preserve your kidney. And even if the worst happens, how do you get the best outcome, even with respect to that subject? Please, I beckon on everybody. Share this very knowledge to everyone. There are people right now drinking nonsense almost at the point of the kidney going without them knowing. You can help them reverse. If you have hypertension, diabetes, if you are HIV positive, hey, please take your drugs. Take your drugs and follow up with your doctor, because this can be prevented. Prevented, I mean. Share to everyone you know, and let us begin to believe in the country we call our own. Watch out for it. We are very optimistic that the people we are running to will very soon run back to this continent in search of best healthcare. Absolutely possible. Let's avoid this humiliation. Enough is enough.